and welcome to ITLS Academy Empower the Youth. So today in this lecture we will going to study about antimicrobial chemotherapy. So it is a very important topic of this medical microbiology as it deals with how antimicrobial therapies work, what are the different sources of antimicrobial chemotherapy, what is antimicrobial chemotherapy, and where it plays a very important role in which kind of patient, and what are the diseases that are associated with this. So let's get started with the topic and let's see what are antibiotics and antimicrobial. So if we talk about antibiotics, so is a lower molecular substance produced by microorganism, that is both molds and bacteria, that at a low concentration at inhibits or kill other microorganisms. So whenever we all are familiar with this term antibiotics, so it is a very lower molecular substance, means it is very small, but it is produced by microorganism, example molds and bacteria, at a very lower concentration, and it inhibits or kills other microorganisms. So they are made up of this molds and bacterias, but they are used in a very lower concentration and they inhibit the other microorganism as well as it kills other microorganism. We all know that this antibiotics, we when we fall ill, when we have a fever, when we are having any sort of diseases, then we generally use antibiotics. So antimicrobial, what is antimicrobial? So first of all, let's understand this term antibiotic. Like we all know that this biotic is living, so against this living, whenever it is when whosoever is working against this living is known as antibiotics. Means we are killing this living organisms, we are working against this living, and what is this living is microorganisms. Same with the case is with this antimicrobial. So what are antimicrobial? As the word suggests, anti means against and microbes means microorganisms, pathogenics microorganisms. So is in any substance of natural, semi-synthetic or synthetic origin that kills or inhibit the growth of microorganisms. So it is a substance that is produced naturally, or they are produced as a semi-synthetic or synthetic origin. Means or a substance would be like natural, of natural origin, it would be of semi-synthetic, or it would be a synthetic origin that kills or inhibit the growth of microorganism, but causes little or no damage to the host. Means they are killing microorganisms, they are killing the pathogenic microorganism, but they did not cause any damage to the host, means humans. So we all know that this antimicrobial, it work against microorganisms, like it kills microorganism, and to an extent that it inhibit their further growth, it inhibit their growth, as well as it does not cause any source of damage to the host. Then comes, before let's start about the types of antimicrobial chemotherapy, but before that let's talk about one thing, that all antibiotics are antimicrobial, but not all antimicrobials are antibiotic. This is very much important, students. Like all antibiotics means whose जितनी भी antibiotics हैं, they are not antimicrobials. Sorry, they are antimicrobials, means they possess the quality of antimicrobials, but not all antimicrobials are antibiotics, means they do not possess the quality of antibiotics. Antibiotics possess the quality of antimicrobials, but whereas antimicrobial is concerned, does not possess any quality of antibiotics. Then comes the type of antimicrobial chemotherapy. So whenever it's a type of antimicrobial, so it is divided into four categories. The first is antibacterial chemotherapy, second is antiprotozoal chemotherapy, third type is antifungal chemotherapy, and the last is antiviral chemotherapy. So whenever it is antibacteria chemotherapy, so this type of chemotherapy, it always associated with bacteria, means it works against the growth of bacteria, it inhibits the growth of bacteria. Now comes the antiprotozoal, means it always work against protozoa species. Then comes antifungal, so it is a type of chemotherapy that works against fungi, that against the fungal infection. Then comes the antiviral, means it always work against the viruses, so means this type of therapy always work against the viruses. Now comes what are antimicrobial agents. So to perform this antimicrobial activity, you need certain types of antigens also, agents also, that can be easily perform the task of antimicrobial. So antimicrobial agents, they are the substances that can stop or slow down the growth of microorganisms such as bacteria, fungi and pests. Means they are the substances that stop, or you can say inhibit, or sometimes even they slow down the growth of microorganisms. Like for example, bacteria is there, fungi is there, pests are there, viruses are there. So some important agents are pesticides, sterilizers, sanitizers and disinfectant, and the third is the medication. So whenever the agent are concerned, the important agents include pesticides, sterilizers, or you can say simple sanitization and disinfectants, and the third is the medications. So whenever it's a pesticide, so pesticides helps to kill or and repel parasites and small insects such as fleas and ticks. So pesticide, this type of antimicrobial agents are mainly used in agriculture industries or agriculture farms, where they are act as a agent to kill, or you can say repel the kill and repel parasites, and it also include a small insect such as fleas and ticks. Now comes the sterilizers or sanitizers and disinfectants. So these are the antimicrobials that are used to clean the surface, water, clothes, hands and other places microorganisms live. They include common products like bleach, alcohol, antimicrobial soaps, and hand sanitizers. We all are familiar with this sanitizer or sterilizer or disinfectant because we all have covered these in our previous lecture. So here it is says, see, these antimicrobials, they are always used to clean the surfaces of your clothes, surfaces of your hands, and even other places where microorganism can live. So they includes like bleach, you can bleach the clothes, mostly all the hotel bed sheets, in fact the all the railway bed sheets and everything, you do bleaching of that. Why? Because just to kill or eliminate if any microorganism is there. Then comes the alcohol. We generally use ethyl alcohol to wipe off the microorganisms. We use antibacterial soaps just to clean our hands while performing any experiments or while working in laboratory industries. And nowadays, just after the COVID virus, we all are very familiar with the sanitizers. This hand sanitizers is not sanitizer, it's sanitizers, sorry students. So the sanitizers are very important. Why? Just to wipe off all the sort of bacteria that are associated with our hands, and to kill them, and to make our hand free from any source of pathogens. Then comes the medications. So antimicrobial medicines, medications, they includes antibiotics, antifungals, antivirals, and antiparasites that works against different types of microorganism, and also help them to remove them from the surfaces or even from the body of a human being or any living host, without damaging, or without, you can say, without causing any little damage to a human beings or the host. Then comes the antimicrobial chemotherapeutic agents. So these are some antimicrobial agents. Now when it comes to the antimicrobial chemotherapeutic agents, so they includes antimicrobial chemotherapy. So it uses it is the use of chemical to inhibit or kill microorganism in the host. So whosoever microorganism is present in the host, let's say bacteria, fungi, or any sort of viruses, so antimicrobial chemotherapy is agent, they are the chemicals, and they inhibit or kill the microorganisms. Then comes the selective toxicity. So this means that the agent that used or must inhibit or kill the microorganism without seriously damaging the host. So all the agents, whether it's antimicrobial or chemotherapeutic agents, so all these agents, they inhibit or they kill the microorganism without harming the host. So based on their origin, there are two general classes of antimicrobial chemotherapeutic agent. The first one is antibiotics, and second is antimicrobial therapeutic chemicals. So based on the types of origin, so they are divided into two groups. The first is antibiotics, and second is antimicrobial therapeutic chemotherapeutic chemicals. So antibiotics, so these are the substances that are produced as a metabolic product of one organism, microorganism, which inhibit or kill the other microorganism. And second is antimicrobial chemotherapeutic chemicals. So these are the chemicals that synthesized in the laboratory, which can be used therapeutically on microorganisms. So antibiotics, these are the substance that are produced as a metabolic products of one organisms, microorganisms. Like for example, if they can also be produced from bacteria or molds, and with a very lower concentration, but it inhibit or kill the other microorganisms. Then comes the antimicrobial chemotherapeutic chemicals. So these are the chemical that are since it is chemical in origin, so they are synthesized in the laboratory, and they are used as a therapeutically on microorganism and inhibiting their growth without further damages to the host. Then comes, what are the use of antimicrobial chemotherapy, means what is the basic use. So antimicrobial chemotherapy has many important uses in healthcare. Treating infections is one of the primarily used. So it is basically used to treat any sort of infection, and this is its primarily use. And apart from treating infection, they are also used in the treatment of different types of bacterial, viral, fungal, parasitic, or other types of infection. Then comes the two, that is bacteriostatics and bactericidal. So these are very important point to understand what is bacteriostatics and what is bactericidal. So if we talk about the first one, that is bacteriostatics, so they inhibit the growth of bacteria, but they generally do not kill the bacteria, means they inhibit, they means रोक देता है bacterial की growth without killing them. They do not kill, but they inhibit their growth, means there should not be further growth. Examples like protein synthesis inhibitors. Then comes bactericidal, so they are the agent that kills the target bacteria. Okay, so like for example bacterio bacteriocin is the bactericidal. So what is the basic difference? So bacteriostatics, they inhibit the growth without killing them, but in bactericidal they are the agents that kills the target bacteria, means they are killing the target bacteria without inhibiting their growth. So how is antimicrobial chemotherapy is delivered? So the delivery of antimicrobial chemotherapy, it depends on the type as well as the its strength of antimicrobial chemotherapy that someone is receiving, right? So basically they generally depends on the type and strength of antimicrobial chemotherapy that someone is receiving. For example, some bacterial infections are treated with intravenous, that is IV antibiotics during inpatient hospital stay. So when a person is staying in a hospital and a patient is having any bacterial infection, so it is treated with IV intravenous antibiotics, right? Then it says it may take several rounds of antibiotics for an infection to clear up. ऐसा नहीं है कि only in a one dose the infection can be cured. No, there must be several rounds just to clear up with the infection. Uh, 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 as it is very severe, or if a bacteria strain is antibiotic resistant, because sometimes the bacteria strain is resistant to certain types of antibiotics, so you need several round, means only not in a very first round the infection would be clear. So you need a several types several rounds to clear up with the infections. Then comes the viral infections. So viral infections are sometimes they are treated with multiple injections given at a regular intervals for a set of number of days or even weeks. So whenever you are having any viral infections, so you need certain types of injection that would be given at a regular interval of times, or you can say at a regular intervals of days, or sometimes even the weeks, to treat the viral infection. Again, the reason is that sometimes they are antibiotic resistant. Then some antimicrobial chemotherapy can be taken at home as a standard of oral medicine that we generally uses, like we take paracetamol when we are having a fever. So apart from paracetamol, we take an antibiotics like azithromycin, right? So it is a dose of 3 days. If you have a fever and you are taking an oral medication at your place, so you take paracetamol with accompanied with this azithromycin once in a day, and it is recommended to take 3 days course of azithromycin, so it may inhibit the growth as well as clear the infections. So some antimicrobial chemotherapy can be taken at home as a oral medication. Your specific infection and the severity of your symptoms will determine how antimicrobial chemotherapy is delivered, means depending if it is a very mild fever, so you can take the oral medicine in your home. But if the fever is very harsh and very high, and could not be treated at your place, so you go to the hospitals or you see any physician to cure up with this type of infection. As in hospitals, they can give you certain types of injections, or they give you certain types of antibiotics for that particular infection to clear up. So this is about how antimicrobial chemotherapy mainly works. Then comes the major classes of antibiotics. So what are the major classes of antibiotics? Sorry, the first major sorry the first major classes of antibiotics is penicillin. So it is produced by a mold, that is penicillium. Then the second class, major class of antibiotics is cephalosporin. So it is produced by a mold cephalosporium. Then comes the third is the bacteriocin, that is produced by bacillus licheniformis. Then comes the polymyxin 6. They are produced by bacillus polymyxa. Then comes the aminoglycosides, so they are produced by streptomycin gracious. So these are the major classes of antibiotics. So the first and the most important is penicillium. So let's see what is penicillium. So penicillin is a medication that are used to manage and treat the viral infections. Treat a wide range of infection, not viral, a wide range of infection. So it is one of the beta lactam antibiotic classes of drugs, and their activity basically describe the penicillin indication, actions, and contradictions as a valuable agent in treating the infection. Then comes how do penicillium work. So penicillin work, so they are the groups of antimicrobial agent and, that attack a wide range of bacteria. So they were the first drug of this type that doctors use. So basically penicillin, or you can say a group of penicillin, so they are the group of antibacterial drug. This is the first drug that the doctors used to cure any type source of viral infection, or you can say infection. So the discovery and manufacturing of penicillins have changed the face of medicine, as these drugs have served millions of lives. Then comes penicillin. Fungi are the source of penicillin, which people can take orally or via injection. People across the globe are now widely use penicillin to treat infection and diseases. So penicillin is important in treating the infection and the several types of diseases, and this is now globally used. Now comes what is an objective. The first objective is to identify the mechanism of action of penicillin. Then comes the describe the adverse effect of penicillium. Then comes the describe the administration of penicillium, just how, like how penicillium will work. Then comes the discussion after interprofessional team strategies for improving care coordination and communication to advance penicillin administration and improves the outcomes. So it is always recommended that you should always use the advanced version of the older one. So that is the reason, and there is a interprofessional team strategies that discuss that how to improve the care coordination, and they can do the communication to advance the penicillin administration and also to improve their outcomes. And then what is the function. So the first function is drug in the penicillin class, so works by indirectly bursting the bacterial cell. So they basically burst the bacterial cell wall. They do not do this by, they act directly on the peptidoglycan, that is the material that is present in the cell walls of the bacteria, or which play, that's what I have told you just that, which play a very essential structural role in bacterial cells, peptidoglycan. Then comes the peptidoglycan create a mesh-like structure around the plasma membrane of bacterial cell, which increases the strength of the cell wall and prevents the external fluid and particles from entering the cell wall. So we all know that the cell wall act as a protective against for any microorganism or any like for any cells, as it does not allow the fluid to enter the cells. So what does this penicillin do? Penicillin directly, or you can say indirectly, it bursts the cell wall, that is the peptidoglycan. Means it directly act on a peptidoglycan. If the peptidoglycan can be burst, then you can easily kill the bacteria. Then comes the when a bacterium multiplies, small holes open in its cell wall, or as the cell divides, newly produced peptidoglycan then fill with this hole or construct the walls. Now the penicillin, they block the protein struts and link the peptidoglycan together. This prevent the bacterium from closing the holes in the cell wall. As the water concentration of the surrounding fluid is higher inside, and water rushes out, and that is the reason the bacteria they gets burst. So this is about how penicillium play an important role in bursting the bacterial cell wall, and by and killing them. So this is all about the lecture. Hope you have understood the lecture. If any doubt, any queries related to the lecture, you can simply drop your queries in the comment section below. In the next lecture, I'll be answering all your queries. And yes, students, don't forget to subscribe ITLS Academy. You can visit our website, that is www.itlsacademy.com. This is our helpline number, that is 7080833450. You can simply call on this number. And yes, thank you for watching. Please do like, share and subscribe, and don't forget to press the bell icon to get latest lecture on the series. Thank you.